Did you know there are 5 different names for lateral epicondylitis? They include shooter's elbow, archer's elbow, golfer's elbow, and more commonly known as tennis elbow. Since tennis elbow is so common among people around the world, we all need to have a complete understanding of this painful injury. Over the next few minutes, I'll be explaining more about what tennis elbow is and its symptoms, some risk factors that come with it, as well as finally how one should treat tennis elbow. Tennis elbow is a painful injury that can affect just about anyone. There are many different definitions as to what is tennis elbow. As referenced by WebMD.com, last updated in January 2012, tennis elbow is a common term for a condition that is caused by the overuse of arm and forearm muscles that can result in elbow pain. As copyrighted on the National Center for Biotechnological Information website, ncbi.com, in May 2011, tennis elbow is inflammation, soreness, or pain on the outside, otherwise known as the lateral side, of the upper arm near the elbow. As mentioned on the MayoClinic.com website, last updated in October 21st, 2010, tennis elbow is a painful condition that results when your tendons in your elbow are overworked, usually caused by the repetitive motions of the wrist and arm. Tennis elbow is associated with many painful and annoying symptoms, as stated on the website orthoinfo.aaos.org, otherwise known as the American Academy of Orthopedic Surgeons website, in November 2009. The symptoms of tennis elbow develop gradually over time, and in most cases the pain begins mild but slowly worsens over weeks and months if the injury is prolonged. According to sportsinjuryclinic.net, a website backed by the American Medical Association, in December 2010, the symptoms of tennis elbow involve pain that is around 1 to 2 centimeters down from the bony area to the outside of your arm. Also, as aforementioned on WebMD.com, the pain resulting from tennis elbow radiates from the outside of the elbow to the forearm and to the back of the hand when one is twisting their arm or grasping something. So this is what your basic elbow looks like, and tennis elbow is this tendon right here, which is what I said, the lateral side of your elbow, and it involves this tendon, which the definition of a tendon is where doctors don't really know what really comes up to it. They might think it's like a certain type of bone marrow or something, but it connects your forearm muscle to your bone directly. And the tear in the tendon is when your arm goes from side to side, never really from up or down. So the reason why it's called lateral epicondylitis is because of, right here, this is called the lateral epicondyle, which is part of the tendon that is used to directly connect the tendon to the bone. And right here, this is just another picture showing the exterior muscle, and this is where the pain is included in your arm when you have tennis elbow. Now that we know more about what tennis elbow is and the symptoms of it, we'll take a look at the risk factors and some causes of tennis elbow, as well as the complications that are involved with tennis elbow. There are many risk factors and causes associated with tennis elbow. When considering how common tennis elbow is to people, there are many factors to take into consideration of it. As aforementioned on MayoClinic.com website, factors that may increase your risk of tennis elbow include age, occupation, and playing certain sports. While tennis elbow affects people of all ages, it's most common in adults between the ages of 30 and 50. People who have jobs that involve repetitive motions of the wrist and arm are more likely to develop tennis elbow, with examples including plumbers, painters, carpenters, butchers, and cooks. Participating in racket sports also increases your tennis elbow, and this is where the name tennis elbow came from, because of the term tennis. And if you employ poor stroke technique, that's what causes it. As aforementioned on orthoinfo.aaos.org, recent studies show that tennis elbow is often due to damage to a specific forearm muscle when overused. Over time, when tennis elbow is left untreated, some complications may evolve. As aforementioned on sportsinjuryclinic.net, there's a possibility that there will be a recurrence of the injury with overuse. Also aforementioned on the MayoClinic.com website, tennis elbow can result in chronic pain, especially when lifting or gripping objects. Now that I've made you aware of all the risk factors and complications involved with tennis elbow, I'll inform you about the forms of treatment that go with it. There are 2 different methods used for treating tennis elbow. The first method is through non-surgical options, with approximately 80 to 90% of all patients seeing success in this way. Also aforementioned on orthoinfo.aaos.org, patients can help cure their tennis elbow through rest, non-steroidal, anti-inflammatory medicines, and physical therapy. Also aforementioned on WebMD.com, through use of an arm brace, the symptoms of tennis elbow can be greatly relieved because of the resting of the muscles and tendons. The second method towards treating tennis elbow is through surgery, if a person's case has not been relieved or gotten better through time. As aforementioned, on the National Center for Biotechnological Information website, the most common approach to tennis elbow repair is open surgery, which involves making an incision over the elbow. According to the aforementioned site, as with surgery, there are risks that come through this method. Some common things include infection, nerve and blood vessel damage, possible prolonged rehabilitation, loss of strength and flexibility, and the further need for even more surgery. I've just made you all aware of what tennis elbow is, the symptoms of it, risk factors involved, and how to treat it. Now that tennis elbow is becoming even more common, it's important for us to understand that we all need to have a complete understanding and knowledge of it. Next time you decide to go and play a fun game of tennis, remember, always use proper technique.